Thank you for coming on to the main line. My name is Mike Ruggiero, and I am a dispensary pharmacist. Today, we are going to be going through some medicinal cannabis foundations. We're going to talk about some cannabinoids, terpenes, and forms of consumption. A little bit about me. I graduated from Philadelphia College of Pharmacy back in 2016. I've worked in independent pharmacy locations. I did what we call MTM-based services. So that just stands for medication therapy management. And what that in essence is I can take your med list, pull out information by having a motivational interview like conversation with you, and teach you about your meds, what other things to look out for, as potentially some recommendations as well. I've also worked retail pharmacy, as well as now I'm medical marijuana. I'm certified in MTM and cannabis for the state of Pennsylvania. And I'm also an American Academy of HIV Medicine certified pharmacist. Currently, I sit on the board of directors for International Society of Cannabis Pharmacists. Disclaimer, cannabis is not FDA approved, so any claims of therapeutic benefit need to be taken with caution. It is for experimental use only, and I am a dispensary pharmacist with Beyond Hello in Philadelphia, Pennsylvania. Now, this is a quick little overview. We're going to talk cannabinoids, terpenes, discuss sativa indica hybrid and how that's actually not accurate, do some ratios and dosing, discuss the vaping crisis, the forms of consumption, medical marijuana safety, as well as some THC first aid. Now, cannabis itself as a plant, the species is going to be Cannabis sativa. We have slight genetic differences that give the effect of what we see as sativa indica or hybrid, less than 3% genetic differences there. Our hemp-based cannabis is still cannabis. It just contains less than 0.3% THC. The flowering tops of the female plant contain what we call trichomes, and these are little fatty sacs that contain all of the medicinal benefits that we see from the plant. Well, not all of the medicinal benefits. We see medicinal benefits from other parts of the plant, but it contains most of the cannabinoids as well as the terpenes, which I'll explain a little bit later. It's also important for me to note that strain is actually not a term used in botany. It is for microbiology, but not with plants. The correct term would be technically cultivar, variety, or chemovar. But this terminology is still kind of embedded into the cannabis culture, so I do use it sometimes, but I'm trying to phase it out as well with my own vocabulary. Now, why is medicinal cannabis used to treat so many medical conditions? Well, we have what's called the endocannabinoid system. And let's kind of break this down. So endogenous means within us. So therefore, the natural cannabinoids that exist within us as humans is going to be called endocannabinoids. The most notable one is going to be called anandamide. And ananda is actually the Sanskrit word for bliss. Now, what does this system really do? It acts as a point-by-point feedback system to kind of regulate all of our different nerve responses. It literally regulates every nerve response. So we call it the guardians of the nervous system. And it plays a big role in modulating our different pain experiences as well as our stress responses. There are many different cannabinoid receptor types, or just receptors that cannabinoids bind to. We have cannabinoids, we have receptors in our skin, and receptors that are affecting our DNA. This is not to say that cannabis changes your DNA. Our body will use our DNA to make different compounds depending on if we're under stress. Cannabis affects its abilities to make certain compounds, which then ultimately can create some end effect, whether that be anti-inflammation. Now, there's also several cannabinoid types. We have our phytocannabinoids, which are found in the cannabis plant itself. We also have our endogenous cannabinoids. I talked a little bit about anandamide. And we have our synthetics, which are way more potent than our typical phytocannabinoids. Today, we're just going to be focusing on the phytocannabinoids. Now, as far as the cannabinoid receptors go, we have two main ones that we're going to talk about briefly today. And the first is going to be the cannabinoid 1 receptor. It's primarily found in our nervous system. It is actually the most abundant receptor in our brain. Now, the second most common place for this receptor to be found is going to be the female reproductive system. This is significant because a woman's estrogen level is going to really greatly impact her experience with the plant, because the higher the estrogen level, meaning mainly premenopause for most women, the lower amount of cannabinoid 1 receptors that are going to be expressed. Now, what does this mean in terms of impact? Well, this cannabinoid 1 receptor is the receptor that creates the euphoria, the intoxicating effects that we feel when we consume cannabis. Now, what happens is if you have less receptors, you can only bind to so many different targets with THC. So ultimately, this is going to result in a reduced overall euphoria, per se, which is often why girls can develop tolerance more easily to cannabis, which also results in worsened withdrawal for them, unfortunately. Again, this is namely premenopausal. It's based on the estrogen levels. Next up, we have the cannabinoid 2 receptors, which are found in our immune system. It's highly located in what we call B cells. B cells are from our bone marrow, so that's why they call it B cells. And these primarily make antibodies. When cannabis binds to these receptors, we're affecting the immune response. We're affecting our body's ability to make different chemicals that may promote inflammation so we can attack an infection. Now, before we really dive into the cannabinoids, we need to talk about how we get THC from the plant. Now, delta-9 THC is the main compound we're all used to consuming, and it primarily exists in the plant as delta-9 THCA. Now, this A is more or less an acid, and it exists as an acid in the plant because this form is actually more stable and isn't going to be degraded as easily or affected by the environment as easily. But when we heat up the THCA, we're going to do what we call decarbing. So we're going to cut off that carboxyl group. So the carboxyl group is the one that's circled in the red square there. And that's effectively our acid group. So when we cut that off using heat, we cleave off the acid and we're left with THC in its active form. We're going to jump into a bunch of cannabinoids today. And I'm someone that's very data driven. I like information that tells me things. So if there's any healthcare professionals listening to this today and I say anything that you have contradicting evidence to, please send me an email. I'm always open to learning more. But without further ado, let's kind of dive in. So our first one is tetrahydrocannabinol, which is THC, which we know and love. It is euphoric inducing or intoxicating, meaning this is what promotes the high. It's psychoactive, meaning it works in your brain. It's sedating. It's good for neuropathic pain. And actually, the Medical Board of California has a guideline written for when to utilize cannabinoids or cannabis for treatment of neuropathic pain. And neuropathic pain isn't your typical pain. It's tingling. It can have a burning sensation. It can move. And if you're not sure if you have this, please talk to your primary care physician or whoever's taking care of you as a healthcare provider. It's an appetite stimulant. It is neuroprotective. The Department of Health and Human Services for the United States actually has, excuse me, a patent on cannabinoids as an antioxidant as well as a neuroprotectant. Just something to think about. As far as weight gain goes, not necessarily going to make you gain weight for most people. It tends to be weight neutral, and that's because we see a neurohormone effect, meaning when you consume cannabis and you have this increased appetite, it's going to affect certain hormones that are going to actually be pro-weight or anti-weight. So what ultimately happens is that the hormones that are produced reduce the weight gain. So we don't necessarily see that effect. As far as anti-nausea goes, the data is a little mixed there. And it's also important to consider the dose you're taking, especially if you want to use it for nausea. Lower doses tend to be better for nausea and have better anti-nausea effects than higher doses of THC, which actually can cause nausea in an individualized setting. It also may be helpful for muscle spasticity in both MS and Parkinson's. Maybe used for PTSD and its associated nightmares. THC actually reduces REM sleep, which is thought to be a big reason why it helps with the associated nightmares. Potentially useful for autoimmune conditions. So THC is going to affect our body's ability to produce some chemicals that are going to promote inflammation. So by using it, for some people, we can reduce the inflammation and then alleviate some of those symptoms. It's also important to keep in mind on the flip side of things. Now, what if I want to stimulate the immune system? What if I have a patient who has cancer and is receiving certain meds that stimulate cell growth? We actually would not want to give THC during that treatment to not impede on the effect of that drug. It also affects regulation of body temperature. So lower doses tend to create hyperthermia, and higher doses tends to cause hypothermia, and you feel really cold. You cannot die from an overdose, but you can still overdose and have really bad acute intoxicating effects of THC, feeling really dizzy, vomiting, being in a bad state. This can just naturally happen from high consumption of THC. And THC does have a few drug interactions. Now, I am a science nerd, and I promise I won't bore you with specifics. The whole purpose of this slide is to show how similar CBD and THC are in terms of structure. A big difference we see with THC is that THC has a full ring to it, and that cyclic ring is circled there, whereas CBD does not. And because it does not, and it's not closed, that whole part of the molecule can actually rotate. And it's part of the big reason why CBD actually can hit up to 65 different targets that are non-cannabinoid receptors. Now let's talk about some of those effects. Now, CBD is non-euphoric. It's psychoactive in that it works in the brain. It affects serotonin, it affects dopamine, it affects a whole host of molecules. And this is actually resulting in different effects. Now, it has antipsychotic activity. Now, what does that mean? It means it can help prevent hallucinations. We think psychosis in medicine. I want you to think about potentially if you've seen a homeless person on the street talking to themselves and responding to stimuli that does not exist, or they're responding to something that isn't there. That's psychosis, and CBD can potentially help with that. Whereas THC, on the other hand, actually can worsen that. It's anti-anxiety. I just said it hits serotonin receptors. If we were to say between the two, CBD or THC, which is better for mental health-based conditions, CBD is definitely better for mental health conditions. It's also better for inflammation. It's more potent anti-inflammatory chemical. It affects our immune response. It reduces appetite. It has anti-seizure activity. Epidiolex is actually a drug indicated to treat some rare childhood seizures. It's neuroprotective. We have data in autism spectrum disorder. May potentially be useful for Alzheimer's, multiple sclerosis, and Parkinson's, but we need more data still. It reduces the negative effects of THC, and it does have drug interactions. And if you're concerned about these, if you're taking a CBD supplement, feel free to talk to your pharmacist or your healthcare professional. Combined with THC, it can potentially, in low amounts, increase the effect of THC while curving out some of those negative effects. And if you take it in high amounts, it can reverse the effect of THC, bringing you kind of back down to earth. And this is something good to keep in mind, especially if you've ever taken too much THC and had a bad experience. It's kind of good to have something on hand that's going to reverse some of those negative effects. Before I even dive in further, I do want to caution that most of the data that we have as far as on the effects of cannabinoids and cannabis in general is based with THC and CBD. The latter molecules I'm going to be talking about now have less data to work with. Now, the first molecule I want to talk about is THCA. Again, it's the precursor to THC. It can be useful for nausea, inflammation. It works at cannabinoid receptors too, but it doesn't cause euphoria because it works outside the brain and spinal cord. CBDA is the precursor to CBD. And actually, it may be more potent at CBD at targeting serotonin. It has great anti-inflammatory effect. It doesn't really penetrate into the blood-brain barrier, and it's thought to enhance the effects of CBD. Now, with these molecules, a few things to keep in mind. Now, it's important to think that if we are inhaling CBDA or THCA, we're going to be heating that up. And otherwise, as a result of that, you're going to be converting the molecules from the acid forms to the THC or CBD forms of the molecules. So if you really want to get the benefit of it, you really want to ingest it. Otherwise, you will not get that. The next one is our cannabigerol or CBG, and it is also anti-inflammatory. I think inflammatory bowel disease. Another way I remembered this at first was CB gut to get the anti-inflammation portion in, but it does have more utility besides for treating inflammation in the gut. It has muscle relaxant activity. It may be useful for psoriasis and depression. It has activity in the skin, as does most cannabinoids. CBC, or cannabichromene, is anti-inflammatory. It binds to cannabinoid 2 receptors, and it also might be useful in depression. Next, we have THCV. THCV has appetite depressant effects. It's good for nausea, may have anti-seizure benefits. But the big thing I really use this for, as far as on the pharmacist end of things, when I get a patient who isn't really open to utilizing CBD, if they want something that's high in THC, I look for a cultivar or strain that's really high in THCV, even though it is a more rare molecule. Luckily for me, there's a few different products produced in the state of Pennsylvania that I do have that has high amounts of THCV. Now, if I get something that's higher, high in THC and high in THCV, that THCV is going to reduce the anxiety as well as any of the munchies associated with THC. Next one is cannabinol or CBN. It's potentially sedating. It has 10 to 25% of the activity as THC at that cannabinoid 1 receptor. But just because something has activity at the receptor doesn't mean it actually creates the euphoric or sedating effects. I will say I do look for it if I'm trying to help someone sleep, but it doesn't necessarily mean that's going to be a driving factor in my decision. It's just something I'm willing to try until we get more data. It's potentially useful in psoriasis and burns, and maybe the cause of many drug interactions, but more data is needed at this point in time. It's also something to think about is storage. Now, if I store my cannabis where it's exposed to THC, sunlight, and moisture, that THC and CBD, they're going to degrade. As well as all the other components of the cannabis, those are going to be affected by those conditions. So if you ever keep your cannabis for a prolonged period of time in these sorts of conditions, you're going to notice a different effect in the product. So I tend to tell my patients to keep it in a cool, dry, moist-free environment as long as possible to preserve the effect of it. Moving on to terpenes. Terpenes are aromatic compounds that add to the scent, taste, as well as the effect of cannabis. They are essential oils that are produced by the plant for antifungal as well as antibacterial effects. I do not ever recommend them being used for those. Now, because they're essential oils, I will say that they don't really have effect alone, but when you combine it with the other cannabinoids and other terpenes, we see a change in the effect associated with the cannabis based on the terpene and cannabinoid content. Let's talk about a few of them now. So our first terpene I want to discuss is going to be linalool. Linalool is found in lavender. It has anti-anxiety effects. It's sedating. It's good for pain. It's anti-seizure effects. Myrcene is found in mangoes. It has muscle relaxant activity. This is primarily thought to be the molecule responsible for the couch lock effect that we see in our indica-based cultivars. It also has anti-inflammatory effects. Terpinolene tends to be found in sativa-based cultivars, and it's also found in nutmeg. It also can worsen some of the negative effects associated with THC. So especially if my patients are worried about trying a sativa-based cultivar or a strain that has high in terpinolene and they don't want to get anxiety, I tend to recommend them moving away from it unless they plan on mixing some CBD in there. Beta-caryophyllene is good for inflammation. It's found in black peppercorns. And interestingly, it's one of 2 cannabinoids that act at cannabinoid receptors. I mean, it's one of 2 terpenes that double as cannabinoids, I'm sorry. The other is caryophyllene oxide, and they work at CB2 receptors. It also can synergize potentially with opioids as well as CBD and THC. Limonene, found in lemons. It has antidepressant effects, anti-seizure effects, and can synergize with both THC and CBD. Pinene is really interesting to me because it has some good effects for reversing the memory cloud or memory fog associated with THC, especially if someone wants to be more clear-headed and they want a THC-based cultivar or strain. Higher pinene can help with that, and it actually has similar mechanism to a drug class used to treat dementia and Alzheimer's. Would I ever use this to treat dementia? No, but if I'm going to be selecting a product to help with clear-headedness associated with THC, I want something that's higher in pinene. It has anti-inflammatory effects as well as bronchodilating effects, meaning it helps open up the airways. Now, let's talk sativa indica or hybrid very briefly. So sativas tend to be tall, thin with narrow leaves. They tend to be stimulating, and they tend to be for the daytime in theory. Indica is short, wide, bushy leaves, puts you in the couch. It's relaxing, tends to be recommended for nighttime, and hybrids can lean sativa indica or be a 50-50 split. Now, this terminology isn't accurate at all, but utilize it as appropriate. Now, if you want to get in and out of the dispensary and keep the interaction shorter, use this terminology. Use whatever benefits you the most. But what the sativa for me isn't going to be necessarily the same for you, because all of our genetics play a big role here. And we really want to kind of focus on the cannabinoid and terpene content to narrow down the effects. Now, if you're sitting there thinking, well, Mike, as a pharmacist, what should I do from your perspective in terms of navigating these products? Well, what I tell my patients to do is when you find a product that you really, really like, keep the box with the terpenes and cannabinoids on the back. I do know every medical program is different with what information is provided, but this is how I navigate in my program. So every product that a patient gets that they like, keep the box, look at what the components are that works for them. If you get a product that you hate and it doesn't work for you and worsens your symptoms, keep the box. Look for trends in those cannabinoids and terpenes that don't work for you. So do that. And if you kind of get something that you can take or leave, it's neither here nor there, don't keep the box. We're not interested in that. Now, and look for trends over time that with all of this. But that is not perfect science because there's over 500 different compounds in cannabis. Everything we like about Western-based medicine, knowing exactly what's in the product doesn't necessarily apply to plant-based medicine. Now, these other components that we don't see on the labeling, that we don't know of, may be enhancing the effect of a product that you like, or creating the effect in a product that you really dislike. And a lot of these don't even have names. So that's something to really keep in the back of your head, especially when you're trying to navigate, because it's going to be imperfect every time. If you get a cultivar or strain that you really like in one state, it may not do the same thing for you in another state, because everything's going to be different also by the geography of everything. So just kind of keep it to a grain of salt. Just because Pineapple Express in California did great things for you doesn't necessarily mean it's going to be the same for you in Pennsylvania. This slide is extremely important. Now, let's kind of walk through this slowly. If I have an isolate, it contains just one compound. So CBD isolate will just have CBD. Broad spectrum products contain terpenes, other cannabinoids, except THC or CBD. So a broad spectrum CBD product will not contain THC, and a broad spectrum THC product will not contain CBD. Full spectrum products contain terpenes and all of the cannabinoids, including THC and CBD. Now, let's talk about this full spectrum product from a treatment perspective. If I want to treat inflammation, let's say if I have arthritis, which is primarily inflammation based, let's pretend that there's 10 different molecular targets that drugs can hit to treat inflammation. There's not, there's a lot more. But let's keep it simple. Let's say CBD hits 8 of those targets. Let's say CBG hits 5, CBC hits 3, THC hits 2, CBDA hits 4, beta caryophyllene hits 3, myrcene hits 2. Now, all of these are going to have overlapping mechanisms. It's going to be redundant in the targets it's hitting. They're also not going to bind very strongly. They're going to bind very gently. And what we see here is an orchestra of molecular multitasking. All these different targets are hitting different receptors in the system and massaging it to the end effect. And this holistic effect of the cannabinoids and terpenes working together from a full, from a whole plant extract is known as the entourage effect. And this is very different from Western-based medicine because typically when we talk about our standard pharmaceutical drugs, they tend to hit one receptor really strongly. They're not hitting all these other receptors. They're only hitting one. Here we're hitting multiple gently and moving the system in one direction. Now, the question I want to ask is, if I have 10 milligrams of a full spectrum CBD product, will I need more or less of that CBD in an isolate? I'll say it again. So if I have a full spectrum CBD product at 10 milligrams, will I need more or less of a CBD isolate to get the same effect? Now, if you're thinking about this, keep in mind the entourage effect here. So we want to think about, let's share the screen. We want to think about the ultimate effect that we're getting here from the different cannabinoids and terpenes. So the answer to this is going to be, it's going to be more. Now, why is that? Because CBD alone is only going to hit those 8 different targets. We don't have all of these other cannabinoids and terpenes working together. So when a patient brings me a CBD isolate that they might have been using from a drugstore, it's really hard for me to help them navigate because we're not really going to get that full spectrum effect. And also the labeling is often all wrong, which is a TED Talk for another day. Moving on, so this is just a visual. So we have our isolate, we have our broad spectrum products, and again, broad spectrum, and then full. Moving on to ratios versus concentrations. Now the ratio or chemotype or chemovar is just another way to make a generalization about the end result of the plant product. So if something's type 1, it's going to be THC dominant. So this can be entirely THC. But if it's leaning THC, this is going to create more euphoria. If it's balanced or 1-to-1 equal parts CBD to THC, it's going to create euphoria, but it's going to be more clear-headed, less euphoria, easier function during the day. CBD dominant products or type 3s are going to create more clear-headedness. So depending on what your goals are as a patient or consumer, how do you want to feel during a given part of the day, you want to consider the cannabinoid content. Now, from a tincture perspective, tincture or solution perspective, what does that mean as far as the concentration? Now, when I first joined Pennsylvania's medical program, I had a coworker tell me how her mom uses a 1-to-1 during the day. They take a full milliliter. It works great for them. And then they take this 5-to-1 THC dominant product. They take a 0.5 milliliter at night. And my question as the pharmacist is, what's the concentration? I don't know what the concentration is. So how do I know how many milligrams you're getting? And this next slide is showing a 1-to-1 balanced product is not the same as another. So if you go down these are some of the products I had to work with in Pennsylvania's program. I made this though about 2 years ago. So some of these products no longer exist. And if they do, they also might have different concentrations. But you can see as you go down the chart that there are differences in the concentration in terms of milligrams per milliliter. The other thing you want to keep in mind too is that these products are going to have differing cannabinoid and terpene content. However, to my knowledge, that only limonene is absorbed in the GI tract. So if you're ingesting these, you're not going to get the impact of the other cannabinoids. But if there are other healthcare professionals listening and they have data I don't, please email it to me. My email is at the end of the presentation. There's also other components besides the cannabinoids. We also see the additives, so like the mint chocolate. A lot of products might have orange extracts in them, not listed here though. And that's something I keep in mind, especially for allergies. So what else is in these products? Let's talk about forms of consumption now. We're going to do smoking, vaping, concentrates, tinctures, capsules / edibles, and oral syringes. Now, a little bit about the vaping crisis, because there's a bit of hesitancy towards whether or not it's good to vape or safe to vape. So there's a big difference between medicinal versus street cartridges or vaping products. The medicinal products are safe. I do not recommend using any street cartridges. I don't recommend consuming any of the Delta 8 cartridges taken off from like some of the gas stations. I don't recommend that at all. And a lot of this is namely due to vitamin E acetate being used to cut or be added to the product. And this was per a CDC report on November 8th, 2019. Heavy metals as well as pesticides may also play a role. We had just under 2,700 hospitalized cases as of 1/14/2020. And at that time, we had 60 fatalities, namely among middle-aged with other medical conditions. Now, let's talk about vaping and smoking. Now, you can smoke the flower, and you can also vape the flower, as well as you can vape in oil cartridges. Now, smoking creates substantially higher temperatures than vaping, and it also creates smoke. Now, two things to keep in mind here. That smoke that you get from smoking the cannabis can actually create drug interactions. So does smoking cigarettes. And if you're concerned about this potential drug interaction, please talk to your healthcare professional and or pharmacist, because it's really hard to quantify how much smoke actually creates an interaction. So I typically tell my patients certain things to look out for. A big interaction tends to be with estrogen supplementation. But again, if you have questions about that, talk to your OBG. Now, when we heat our plant matter or flower, using smoking as a method, we're going to be going over temperatures above 400 degrees, which vaping doesn't hit. Now, when you go over that temperature, about 30% of that THC you're consuming is going to get converted to CBN. And this plays a big role in the differing effects that you see between smoking and vaping. Whereas vaping, you do not get that effect. Concentrates, they are definitely not a product for novices. I never recommend this to an inexperienced consumer. They're pure cannabinoid and terpene extracts. And we see different types, whether that be butter, sauce, sugar, shatter, diamonds, wax, there's more, based on the extraction method and its cannabinoid and terpene content. To me, I really think rosin is super interesting. How it's extracted is what we call thermobaric. So we use either high or low temperature with pressure. So thermo, temperature, baric means pressure. And you take your flour and you squeeze it with high or low temperature, and you get this oil that comes out, which is our trichomes. And now the trichomes, like I said before, is what contains the majority of our cannabinoids and terpenes. And that can be then used for consumption, either using a specialized rig that you can use a blowtorch to heat up, or use a specialized device to heat up to higher temperatures. Now let's compare the inhaled form. So temperature-wise, dry leaf vaping is the lowest, followed by vaping, followed by smoking, followed by concentrates. Safety, smoking isn't good for you. Now, smoking cannabis does not cause lung cancer. It does cause increased mucus buildup, and it does increase risk for pneumonia. As far as safety between the other components. It's really hard to say at this point because we kind of need more information. Does the extraction method matter? Does the device matter? But at the very least, I can say smoking is not necessarily the best, and per the reasons I just went over. Potency-wise, dry leaf vaping has the lowest THC blood levels, followed by smoking, followed by concentrates. But again, this is just blood levels I'm discussing, not necessarily effect. The onset of effect is between 5 to 10 minutes and lasts 2 to 4 hours. Next, moving on to oral products. There are capsules, there are tinctures, we have oral syringes, and in not in my program, but in other programs, we have gummies, brownies, and more. Now, the reason why, depending on what program you're in, the gummies and brownies aren't made legal is because those products, it's really hard to get an even distribution of cannabis throughout it. So one end of that brownie might have a different dose of THC than the other end. Same thing with CBD. The other thing is that the absorption of these gummies and brownies are going to be the most erratic as opposed to the others. Now, in general, though, the absorption of the products are going to vary product to product, batch to batch, consuming with or without food. Now, when we talk about food, I want you to think about, will THC and CBD be dissolved in oil or water? Well, the molecules are fatty in nature, so they're going to be more dissolved in oil. So we want to take our edibles with some food. That way we get some fat in our stomach to enhance the absorption. Our consumer genetics are also going to play a role in your metabolism. And then on top of that, for everything, your endocannabinoid system expression. So the receptors, the enzymes that break down the different cannabinoids. It's all going to play a role here. So that also plays a big difference as to why all these products affect individuals so differently. Now, this slide looks like a lot of fancy science, but I'm going to break it down real easy because it explains a lot of the differences between edibles. So when we eat anything, whether it be food, other drugs, we take it by mouth, when it goes from the stomach to our small intestine, about 60 to 80% of this is going to get funneled directly into the liver before being let into the blood. And when THC goes through the liver, it gets converted to this 11-hydroxy-THC metabolite or byproduct. This is more potent at penetrating into the brain. It is 5 times more potent than THC in general, and it lasts longer in the body, which explains why edibles kick in later, and also explains why when they do kick in, they last longer. They have this extended release effect associated with them. Now, I've come across many patients who tell me that they can't feel the effect of the edibles. Now, this can be due for a number of different genetic reasons, and it is being researched, but there is one specific enzyme in your liver that THC is metabolized mainly through. And if you do not express this enzyme that breaks down the THC to this metabolite, you're not going to really feel the effects. Everyone expresses different enzymes in the liver to differing effects. And if you don't express this to a high amount, you're not going to get the same end results. Now let's talk about capsules and tinctures first. Now, capsules have a set dose. And then also capsules, they tend to contain the cannabis in what we call MCT oil. MCT stands for medium chain triglyceride oil. And what are medium chain triglycerides? Well, we have olive oil, we have coconut oil, and if you're bougie, we have avocado oil. But I've honestly never seen avocado oil in my program ever. I'm not sure if any high-end places utilize that, but not something I've seen. Like I said, though, most capsules tend to have MCT oil. At least I can only speak for my program. Now, the onset of effect is going to be about 90 minutes with the edibles and capsules, and it's going to last about 4 to 6 hours. Now we have tinctures. The beauty of these is that you have a modifiable dose, and I like using them because it allows me to slowly titrate or increase a dose up or down for patients so we can kind of find their sweet spots. Now, they have different bases. The alcohol or glycerin-based tinctures are actually real tinctures. And the reason I'm saying they're actually real tinctures is because the alcohol or glycerin as a base allows for absorption under the tongue or through the cheek. And this is effectively what a tincture does. So if your tincture has an alcohol or glycerin based, you want to hold it underneath your tongue for 30 to 60 seconds and then swallow and then take some food. Or you can take food beforehand. Those with MCT oil as the base, I do not recommend you hold that under your tongue at all. You're just going to be subjecting yourself to some bad taste. Just take it back like a shot or just swallow it and then take some food. Because of these differences, the onset of effect for alcohol or glycerin-based products are going to be 15 to 30 minutes, whereas the MCT oil is going to be about 90. The duration of action is going to be about 4 to 6 hours. Now, I also get patients asking me if they can mix things or tell me they're going to be mixing their cannabis product in with their teas or other different liquids. I don't recommend that often because the tea is going to be mostly watery, right? And I said before that THC and CBD, they like oil. And so this isn't going to be well dissolved into that solution. Now, if you have a product that has a lot of CBDA or THCA, the acids, that actually can help enhance the absorption because it kind of acts as an intermediate to help get that stuff, the CBD and THC, absorb better in our bodies or dissolve better in that. I've had patients mix these with shakes, and I just tell them, make sure you have some fat content into whatever you're mixing. We have oral syringes as well, depending on what program you have. The distillate syringe is very similar, or depending on where you are, it's the same thing as what is in the vape cartridges. They're very potent. You have a modifiable dose. There's no plant matter. It requires some dexterity to use. It can be hard on the hands depending on the individual. I tell patients, depending on how they're working with it, to run it under warm water. Just make sure it doesn't get in the back of the plunger. It's very flexible to be used, and it's extracted with CO2 extraction. But I'm not discussing extraction today. That's a TED Talk for another day. Now, when you're dosing the syringes, if you have a pen nearby, if you click that pen open, that's going to be about your starting dose. A quarter of a grain of rice is what we typically say. These things are very potent. You can mix it in with food. There's a lot you can do with them and just slowly increase your dose. Rick Simpson oil or RSO, I would implore you to Google Rick Simpson and look up the story behind him. It's a very potent oral syringe. It's a modifiable dose. And because it uses ethanol-based extraction, it pulls out the plant waxes very well. So these contain the whole plant matter, and they typically are darker in color. You see you're getting the different plant molecules like the chlorophyll. So it's going to look differently. It's going to be very goopy. It can get stuck in your teeth. I tend to tell patients to mix it in with food, put it in a cracker or Oreo, eat it that way. There's a lot that you can do with it. Now let's just compare the two forms. So inhaled is going to have a fast onset with variable absorption based on temperature, depth, and hold, higher THC blood levels, low metabolite levels, a short duration of action, and when you're dosing, start low and go slow. Longer onset of effect is associated with oral products, variable absorption based off of food, stomach contents, and liver function, low THC blood levels, high metabolite levels. We have a longer duration of action, and we want to always start low and go slow. Now, let's just look at some of these differences from a bigger point of view. So if I'm going to be inhaling our product, we get quick peaks and quick drops. So it's almost like an immediate release effect. Whereas the oral products are going to be a little bit more delayed in effects and last longer. Now let's talk about this from a medical perspective. Let's say you're having a hard time sleeping. If you're having an issue falling asleep, I would suggest using an inhaled product about a few minutes before bed, because that's going to kick in faster. It's going to help you fall asleep. If your issue is staying asleep, I'm going to suggest that you take an oral product about 90 minutes before bed with a snack. Now, everyone has different suggestions as far as how to do this, but this is just my take on it. Take about 90 minutes before bed. And the idea is, as you're falling asleep and getting into bed, this will kick in and help you stay asleep. Or if you have both issues, falling and staying asleep, do both of what I just said. Topicals are available in different programs. There are lotions, salves, and creams. It's often marketed as also transdermal or topicals. Transdermal implies that it gets through the layers of the skin, but it's really hard to say whether or not a product is really transdermal without actually having the data to show that it is transdermal and that can reach those layers of the skin. It's good because you can treat those localized symptoms. You do not see euphoric effects because there's no first pass metabolism. So topicals will not make you feel high. The non-active ingredients here play a big role in increasing the absorption through the skin. So this is something we want to keep in mind too. Let's say if I'm recommending a topical that is equal parts THC and CBD. I often tell my patients that if this product doesn't work, don't think that that ratio of cannabinoid isn't going to work for you, because those non-actives play a big role in the absorption. And my program, I don't really have that listed on the labeling, so it's really hard for me to even make any good judgment calls on that. CBD and CBN are actually 10 times more permeable to the skin than THC. THC actually has the least absorption out of all the cannabinoids, but everything has therapeutic benefit. Suppositories may also be in your program for rectal or vaginal use. Now, THC does not show any absorption rectally. Now, why is that? The reason is that our colon, it's a place where some water is absorbed. The majority of water is absorbed from the food we eat in our small intestine, but our large intestine does absorb a little bit of water. Now, because it absorbs water, that means the walls of that part of our body, meaning the large intestine, is going to be more permeable to water. Like I said earlier, THC and CBD don't like water, so because of this, they're not going to be really absorbed as well. So there is the hemisuccinate form, which makes it more water soluble, and this will enhance absorption. Now, I have actually never seen this form in my program, so I often don't recommend suppositories for rectal use. I tell patients if they have a hemorrhoid, they can try it for the localized symptoms, but it's not something I recommend immediately in my head. And again, because we're not getting first pass effect here, it's really not likely to cause euphoria. And although there are no studies in vaginal suppositories, they have some anecdotal utility. I've had a woman with endometriosis and polycystic ovarian syndrome use them at night. So that's something to consider to try, but not necessarily anything that I have studies on to cite. Also, speaking of feminine use products, I often have some of my female patients apply topicals to their abdomen, or anyone who has, or for my patients who have a female reproductive system, if they have issues with endometriosis, polycystic ovarian syndrome, or any pelvic floor issues, I suggest them they can apply the topical to their abdomen or belly. I actually had a patient come to me in the dispensary. We were having a sale on our topicals, and our 50/50 1-to-1 CBD product that we had in stock was a little bit more expensive, and this individual did not want to spend the extra money, even though they were having a sale, even though we were having a sale. And I kind of nudged her in the direction of getting it. And the next day, they came back and bought another bottle. So it did help, something just to consider. Now, when we're dosing, this is just everything we want to think about. We want to think about our cannabinoid layer. We want to think about our terpene layer, and this leads into our entourage layer. So start low and go slow. Now, let's talk safety a little bit. Now, side effects of THC, most of us are used to these. Promotes anxiety at lower doses and can promote paranoia as well as anxiety at higher doses. Oh, sorry, I misspoke. It's anti-anxiety at lower doses. It can also cause elevated heart rate. It's anti-nausea at lower doses, but promotes nausea at higher doses and can result in cannabis use disorder. It does have some addictive potential. CBD can cause diarrhea if eaten. Now, if you're taking a CBD-based product and let's say you get a dose that you love, let's say 50 milligrams works for you, and you take that 50 milligrams in the morning, it causes immediate stomach upset. Now, what I'll tell you then is split the dose. Take 25 milligrams in the morning with food and then take 25 milligrams 4 to 6 hours later with food. It tends to be stimulating at lower doses because it hits serotonin there, and it's sedating at higher doses. And this is where we see our anti-seizure effects. It can suppress appetite, and the maximum single dose ever given to an individual is 6,000 milligrams. Now, this creates some difficulty for me as a pharmacist because I said earlier that this has drug interactions and we should check for those. Well, the dose can be anywhere from a milligram really all the way up to 6,000 milligrams. So it's really hard for me to gauge the significance of this. So I tend to tell my patients, especially if there is a significant drug interaction, I tell them the side effects to look out for that medication. And if the side effects start when you either start the CBD product or when you increase the CBD product's dose. Now, this slide on cannabis toxicity, I want to slowly walk our way through. Now, the bottom axis or the x-axis says active dose divided by lethal dose. So the higher our lethal doses, or the larger the difference our lethal doses from the active dose, the less lethal it's going to be. So if marijuana, let's say, has an active dose of 1 milligram and a lethal dose of 8,000 milligrams, it's going to be really, really low on that scale. So that would mean it's not toxic if it's the closer it is to the y-axis. Now, on the y-axis or our vertical line there, it has dependence potential listed. So as we are increasing up that chart over there, we're going to be seeing an increased risk for dependence. Now let's highlight a few of these. Now, cannabis, out of the ones highlighted, has the least lethality out of all the molecules, but it does have the same risk for dependence as caffeine. So they're both equally cause some risk for dependency. Caffeine has a lower lethal dose, so it's more lethal. Then nicotine's up next, and it has the highest dependence potential. And the last one I have highlighted is alcohol. It is the most likely to be lethal out of all of these, and it also has higher dependence potential. So this is just something I want to put in perspective for those of you who are thinking about cannabis as far as safety goes. I will say cannabis is safer than alcohol, but you do have to check for a few things. So it's always important to keep that in mind. As far as special populations, there are some concerns in pregnancy, pediatrics, as well as the elderly. Breastfeeding as well is something to consider. And these are all conversations you can have with your healthcare professional. But if you have questions on any of these, I'd be happy to answer them at the end. There is some potential for heart risk. There was an article recently published that was created a little bit of scare. The heart risk really isn't clear yet. I'm not overly worried about it at this time. But again, if there's healthcare professionals listening and you have good studies to send my way, I would greatly appreciate it. The liver effects, not necessarily as concerned with those. Lungs, we have the effects we talked about. We talked about the psychosis. We talked about drug interactions. And then we also have what's called cannabis hyperemesis syndrome. Now, this is definitely a full TED talk for another day, but I will say cannabis hyperemesis syndrome is a cyclic vomiting like syndrome that is uncontrollable and happens after many years of high chronic cannabis use in some individuals only. And the only really way to stop it from occurring over and over again is to stop cannabis use. Now, we do have some concerns in mental health. Like I said earlier, patients with psychotic disorders like schizophrenia, and these people are going to have hallucinations, who use cannabis will develop these psychotic disorders or schizophrenia at an earlier onset and have a worse course of disease. This isn't to say cannabis causes the condition. It just makes it show up faster and have a worse course. Cannabis may worsen disease course in patients with bipolar disorder, namely the manic symptoms. Manic symptoms tend to be you're more upper, you have more energy, you have different hobbies. There's a whole host of other things associated with it. But this association really isn't clear. And CBD may have antipsychotic effects, like I stated earlier. A little bit about cannabis first aid. We have CBD. As our names say, we could use our terpenes that work well with it. So beta-caryophyllene is found in black peppercorns. Limonene is found in lemons. I'm not going to tell you to eat pine cones, but selecting a cultivar that has CBD and it's high in pinene might be useful for you, especially if you want to inhale it. Hot showers may be helpful. The THC doesn't like heat, remember? So it's going to help bring that down a little bit. And the hot showers will also activate different receptors that may also help counterbalance that experience. And can you overdose? Well, you can overdose in terms of having a really bad experience with nausea, dizziness, vomiting. You may be in a state of really bad energy or dysphoria. But as far as you dying from that overdose, not likely. And those people who've died from cannabis, there were only 2 cases really potentially associated with cannabis hyperemesis syndrome that have been documented that have been associated with death. So only 2 cases that I know of. And moving on, I'd like to close with questions. So thank you all for listening. Here's my email. So if you want to contact me, it's michael.ruggiero, RUGGIERO @beyondhello.com. With that, we can open to some questions. Does distillate take away the terpenes? That's a great question. Not necessarily. So depending on the extraction method, you will see a loss of terpenes. Others can preserve it, but it's all varies per extraction method. Some dispensaries, some growers will actually add those back in following the extraction to replace those. But it really all depends on the extraction method. Great question. The next question is about vaping increasing tolerance. Now, typically vaping wouldn't necessarily increase tolerance in theory. Now, if you were pulling on that vape at high rates and getting a lot of THC in, maybe even more so than you might have with smoking, that's the mainstay associating with tolerance. So the more cannabis you consume, the more tolerance you're going to get. What kind of happens with tolerance is you're going to have all these cannabinoid receptors. Now, if you consume high amounts of THC, you're going to keep bombarding those receptors. And if you continue to hit those at high rates, your body is going to respond by pulling that receptor in and reducing the amount that's expressed. And that's how tolerance occurs. So I wouldn't necessarily say that vaping would cause that, but high cannabis consumption would cause that. Now, you can always take a tolerance break, whether it be for 3 days, 2 weeks, or a whole month. If you want to completely reset your tolerance, you could do that if you want to increase it, depending on your consumption levels. I also tell patients to kind of mix CBD in the mix to kind of help with that effect too, but I don't really have the data on that, but if anyone does, I'll take it. A great question. Is cannabis a plant that keeps on giving in a tincture? I'm not really sure what that question is asking. Can I get any clarification on that? Oh, great question. All right, gotcha. So that's different. You can definitely get other benefits from it. So the seeds, the leaves itself are going to contain other things like flavonoids and stilbenoids that you're going to get benefit from. So you're going to get a differing effect. And when it gets stronger, stronger is a hard term for me to really pinpoint, but you will be getting other components there. Now, it also depends on what you're getting out of it. I do know of people making their own teas from the leaves or mixing it in with smoothies, but you're not going to see it associated with typically in the tinctures. You're going to, when you have the tinctures, there's going to be no plant material in there. But if you want to add the leaves into things like your into your smoothies or your teas, that's one way to do it, but you're not going to really get that in a tincture. But if anyone has seen it in a tincture, please let me know. Curious. Mixing CBG with THC flower is definitely great. This is the benefits of CBG. CBG is a cannabinoid that I really, really enjoy. It's a good molecule for mental health, potentially, and it's good for inflammation. So yeah, that would be a great combination. And I guess I'll take maybe one more question and then we'll close everything out. Or if we don't have any questions. Well, I guess we're going to wrap things up. So thank you all for coming onto the main line. My name is Mike Ruggiero, and thank you for listening to my presentation. If you have any questions, my LinkedIn was provided. You can reach out to me on there. And you also had my email. So thank you so much. It was a pleasure. And have a great rest of your evening. Thank you.